Toremifene, also known as Fareston, is a medication used in postmenopausal women to treat breast cancer. It is specifically used to treat cancer that is estrogen receptor positive, meaning the cancer needs estrogen to grow. Fareston is a nonsteroidal antiestrogen that works by blocking the effects of estrogen in the breast tissue, which helps to slow down or stop the growth of the cancer. The usual dosage for Fareston is 60 mg once a day, and it is best taken at the same time each day. It can be taken with or without food. Always follow your doctor's instructions for the best results. When taking Fareston, it is important to follow your doctor's instructions. Typically, it is taken orally, either with or without food, once a day. The dosage will depend on your medical condition and how you respond to the treatment. To ensure you get the most benefit from Fareston, it should be taken regularly at the same time each day. Remember not to consume grapefruit or grapefruit juice while taking this medication, as it can increase the chance of side effects. If you have any concerns about this, be sure to speak with your doctor or pharmacist. It's important to note that Fareston can be absorbed through the skin and lungs, so it's crucial that women who are pregnant, or may become pregnant, avoid handling the medication or breathing in the dust from the tablets. If you notice any worsening of your condition, such as new breast lumps, be sure to inform your doctor right away. If you experience hot flashes, sweating, nausea, vomiting, dry eyes, or dizziness while taking Fareston, be sure to inform your doctor. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using Fareston do not experience serious side effects. However, you should contact your doctor immediately if you experience any of the following: bone/joint/muscle pain or swelling, constipation, mental/mood changes, such as depression, trouble walking/clumsiness, swelling ankles/feet, unusual tiredness, vision changes, such as blurred vision, eye pain, easy bleeding/bruising, signs of infection, such as sore throat that doesn't go away, fever, chills, symptoms of liver disease, such as nausea/vomiting that doesn't stop, loss of appetite, stomach/abdominal pain, yellowing eyes/skin, dark urine. It's important to note that Toremifene, the active ingredient in Fareston, may increase your risk of uterine cancer. If you experience changes in menstrual period, unusual vaginal bleeding/discharge, or pain/pressure below your belly button, navel, inform your doctor immediately. Fareston has been known to rarely cause very serious, possibly fatal, blood clots in the lungs/legs, brain, stroke, and heart attack. Seek medical help right away if you experience pain/swelling in the groin/calf, pain in the chest/jaw/left arm, confusion, fainting, severe sudden headache, trouble speaking, sudden vision changes, shortness of breath, or weakness on one side of the body. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. When taking Fareston, it's important to be aware of the potential side effects. Some people may experience serious heart rhythm problems, which could be fatal. Seek medical help immediately if you notice any of the following rare but serious side effects: fast or irregular heartbeat, seizures, severe dizziness, or fainting. It's important to note that the risk of heart rhythm problems may be increased if you have certain medical conditions or are taking other medications that can affect the heart rhythm. Be sure to inform your doctor or pharmacist about all the medications you are taking and any medical conditions you have, especially if you have a history of heart problems or low levels of potassium or magnesium in your blood. If you are using certain medications like diuretics, or if you experience conditions such as severe sweating, diarrhea, or vomiting, your risk of heart rhythm problems may also increase. It's essential to have a conversation with your doctor about using Fareston safely. Regarding the daily dosage and optimal timing to take Fareston, it's important to follow your doctor's instructions. They will determine the appropriate dosage and the best time for you to take this medication based on your individual needs and medical history. Before taking Fareston, make sure to inform your doctor or pharmacist of any allergies you may have, as this medication may contain inactive ingredients that can cause allergic reactions. It's important to also discuss your medical history, especially if you have conditions such as bone cancer, blood disorders, diabetes, stroke, blood clots, heart disease, high blood pressure, liver disease, or uterus problems. Fareston may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness until you can do them safely. If you are using marijuana, make sure to talk to your doctor about it. Additionally, if you will be having surgery or will be confined to a chair/bed for a long time, let your doctor know. If you are pregnant or planning to become pregnant, it's important to discuss the potential risks and benefits of using Fareston with your doctor. Women of childbearing age should use reliable non-hormonal birth control while using this medication. It's also important to consult your doctor before breastfeeding while using Fareston. It's important to be aware of any potential drug interactions with Fareston. These interactions can change how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products. Share this list with your doctor and pharmacist before starting Fareston. Some products that may interact with Fareston include blood thinners, like warfarin, as well as estrogens and tibolone. It's also important to note that many other drugs besides Toremifene, the active ingredient in Fareston, may affect the heart rhythm, including amiodarone, granisetron, pimozide, and others. Additionally, other medications can affect the removal of Toremifene from your body, which may impact how Fareston works. Examples of these medications include azole antifungals like ketoconazole, rifamycin such as rifabutin, drugs used to treat seizures like carbamazepine and phenytoin, and St. John's wort. Always consult your doctor before starting, stopping, or changing the dosage of any medicines while taking Fareston. The daily dosage and optimal timing for taking Fareston should be determined by your doctor based on your specific medical condition. If someone has taken too much Fareston and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important not to share Fareston with others. Before starting this medication and during its use, it is essential to undergo lab and/or medical tests, such as a complete blood count, calcium levels, liver function, and pelvic exam. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Fareston, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed one. Take your next dose at the regular time and do not take 2 doses at once to make up for the missed one. It's important to store Fareston at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from the reach of children and pets. When it comes to disposal, do not flush Fareston down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.